Thanks for coming today. I have been told that it is always like this in Wisconsin in October. So I will be back if that is the case. So I have a few talks today, but I'm a really informal speaker, so I would love it if you have questions, shout out, raise your hand, and we can digress as much as we need to. So just as a little background on myself, I'm a trained veterinarian from Cornell University. I did an internship and residency with the Ambulatory and Production Medicine group, and I then followed that up with a PhD in epidemiology, and then Cornell made me leave. So I was on faculty at Colorado State University for a year and a half, and then I have moved back to Ithaca about a decade ago and have been on the faculty of the vet school at Cornell since then. And I spend some of my time as a dairy vet teaching our fourth-year vet students how to do their job on dairies. And so we service an area about 25 miles around Ithaca, New York, and we cover all large animal species, but I focus on dairy cows, and we service anything from 40 cow tie stalls to 5,000 cow freestall herds. So we have really a wide range in the area. And then I have a group of graduate students and postdocs who work with me on applied transition cow issues that we see on our dairy farms and dairy farms in our area and through the US. So it's really nice because we can be on farms, see issues, talk to our producers, and then try and get in the lab and answer those. And so today when we talk about what is dyscalcemia, this is a question that arose from my work as a vet, and then we addressed in the lab. So I'm just going to talk a little bit about hypocalcemia and the history in general, because I think it's a really interesting disease. And then I'll present some research that we've done on subclinical hypocalcemia, and I'll talk about the dynamics of calcium after a cow calves. And then we'll talk about this term dyscalcemia and dry matter intake effects. And then we'll talk about, in this part of the lecture, on how we determine the calcium status of cows. So hypocalcemia is actually, as in the milk fever form, clinical hypocalcemia is one of the oldest dairy cow diseases mentioned in the literature. So it first appears by a gentleman in Germany in 1793 as being a problem. And 100 years later, they found out what caused it. So they found that this only happens in cows when they start making milk. So they looked in the milk, they saw bacteria, and they thought it must be an infectious disease. And so they treated it by infusing 1% potassium iodide up the teats. And it was actually very effective because the cow stopped making milk, and then she regulated her calcium, got up and was fine. She just did not make much milk after that. A few years later, we moved from potassium iodide to inflation of the udder. And this is actually a udder inflation device that one of our emeriti faculty in the ambulatory clinic had that I found one day. And so you'd stick the little end up the teat canal, and then just like a pump, you'd pump air into each quarter. And what that did was it caused the quarter to expand, and then you had a negative feedback loop, just like udder engorgement. So that would reduce their milk production. Interestingly, one of the gentlemen who attended yesterday said that when he started as a bovine vet in practice in the 80s, one of his elderly clients, the first time he went there, he saw a bicycle pump when he walked in the door and a couple cows with twine tied around their teats, because that's what they were using. So he gave them alternative methods. But so these cows also, it helped them with their milk fever, but then they all got mastitis. So it wasn't until 1923, we were still looking around what this was. People thought maybe it was hypoglycemia. But in the 1920s is when we really started looking at hypocalcemia and low calcium as the cause. What I think is really interesting is for these cows with milk fever in the late 1920s is when we started giving them intravenous calcium gluconate. And almost 100 years later, we're still doing that same treatment today. So just an interesting history of the disease. The nice thing is with the management and the nutritional practices that we put in place now, clinical milk fever is not as common as it used to be. We still see it on our dairies. Nationwide, it's about 5% incidence, but on many dairies, they can keep that under 1 to 2% with good management and nutrition. So today, we're going to be mostly talking about the subclinical form of hypocalcemia, where cows that look totally normal to us are walking around and having blood concentrations of calcium that we think are lower than they should be. And we're going to talk about the effects of that. And one of the reasons that subclinical hypocalcemia is so important and is also very prevalent is because of the increase in milk production of cows over time. So this graph is showing the increase in production per cow. It's in kilos from 1900 to 2000. And this next graph on the right shows the increase from 2012 through 2021. So just in that 10-year span, average milk production went up 10% in these cows. And so we've done a really good job accommodating clinical milk fever in that time. But what we're finding out now is we have a lot of cows that have subclinical hypocalcemia and are suffering from those effects. So to help put you kind of in context about how much calcium cows need, in general, an adult dairy cow needs about 21 grams of calcium per day just for her normal body function. So just to be able to walk around, get up, lie down, breathe, ruminate, all of those important aspects. So that adds up to 21 at the end. At calving, they need the 21 grams for their self, and they're also putting 23 grams of calcium into the one dose of colostrum. So in that very, very short period, her calcium requirement has doubled. And by 7 days in milk, if we assume that she's making 100 pounds of milk per day, she again needs the 21 grams for herself. And then she needs 56 grams of calcium for what she's putting in that 100 pounds of milk. So over the course of 7 to 10 days, these cows' calcium requirement is tripling. And for our really high producing cows, it's sometimes quadrupling. So you can imagine this is why it's so important for us to make sure these cows are transitioning well into lactation, that they have well-formulated rations, that they're eating as much as they can and being they're comfortable, because we really need them just on the calcium part, in addition to energy and everything else, to be reinvigorating their calcium stores. So fortunately, cows deal with low blood calcium. They have a regulatory mechanism. And so low blood calcium concentration is sensed by these little cells in the thyroid, in the parathyroid gland, which is near the thyroid gland in the neck. And what happens is that PTHs increase. So parathyroid hormone is secreted into the bloodstream, and that has several functions. So one of the functions is it reduces calcium excretion by the kidneys. So it's telling the cow, I want to keep as much calcium in the body as possible. It also activates the conversion to active vitamin D, which we'll talk about shortly. Increased PTH also begins calcium release from the bone. So as you know, in cows, most of their calcium is stored in bone, and so that release is something that's needed so we can increase increase calcium in the bloodstream. And then the third way that they increase their calcium is through uptake from the GI tract. So normally calcium concentrations are higher in the lumen of the intestine, and because of that, if you remember back to biology and chemistry, it will cross its gradient, so it has paracellular transport into the bloodstream. But when vitamin D acts on the gut, because it's been activated by PTH, we then start actively pumping calcium into the bloodstream. And so through a reduction in calcium excretion, and increased absorption from feed, and increased absorption from bone, this cow will increase her blood calcium concentrations up to normal levels. So one thing I want to point out here is that, and we'll talk about this more later, but the active the kidneys and calcium metabolism happens within minutes of when a cow senses that she has low blood calcium concentrations. Calcium absorption in the intestine and the full extent of release from bone, it takes days to really get this going. And so this is one of the problems we see in cows that calve, is that they can't, if we don't do what we need to do in the prepartum period, they can't regulate this as quickly as they need to for the amount of milk that they are producing. So we'll talk more later, but just remember that she starts activating this physiology within minutes of low blood calcium, but it really takes days to get totally mobilized.